Good afternoon, everyone. Thank you again for joining us in Ellie on Point, whether you're here live or whether you're watching the replay. We welcome you. And it is my goal to bring a lot of healers and practitioners, biohackers here so that you understand exactly that the body is equipped with everything it needs to heal itself. We just need the wisdom. We need the tools. We just need practitioners like Dr. Julie, my guest here today, to teach us certain modalities. And I'm very excited to have Dr. Julie here because this is one of the most, I think, one of the most powerful modalities I've ever encountered. And though I'm very new to it, I understand the amazing potentials that it has and hoping that this particular technique can be practiced and taught in the Philippines by Dr. Julie herself. So without further ado, everybody, please welcome Dr. Julie Russell Clark, who will talk to us about neural organizational technique, or N.O.T. Hi, Dr. Julie.
Hi, Ellie. How are you? Thank you for asking me on your amazing show. I find it very encouraging that you are doing the biohacking, which I knew nothing about really until I met you in online with Dr. Ferrari and Dr. Carlin with the N.O.T. Module 1. So well done for learning this technique. N.O.T. has been part of my life since I graduated from university in the UK and then here in Melbourne. At the time when I graduated, I had to redo my exams in Melbourne, but I had the absolute amazing experience of meeting Dr. Carl Ferrari very shortly after I graduated in London. He's not with us any longer, but his information that he's left us, chiropractors, kinesiologists, osteopaths, anybody who's got 3 years science behind them can learn N.O.T. It's interesting. I find it very interesting the work that you've been doing and the last couple of interviews you had with Enzo, and on also the Buteyko technique that you were talking about. And what I was thinking is that what we're all really doing is we're working to deregulate the nervous system, deregulate the fight-flight reflex.
Yes.
And N.O.T. stands for Neural Organization Technique. And N.O.T. is basically a technique, what it says it is. It's a technique that organizes the nervous system. It's pretty simple, really. In the application, it's very wide and very deep. And the primary goal is to bring us back to center, to open the consciousness, to regulate the nervous system, to downgrade the parasympathetic nervous system so rest, relaxation can be an everyday part of our lives, and that we can manage the stresses, which are huge out there in society these days, and I believe are a lot to do with the problem with the human condition as a whole.
Yes.
Yeah.
That's what I love about it. And for some people who know me here in the Philippines, I work with special needs children, and I do something called the Feldenkrais method under the Anat Baniel method sigil. And so we are body workers. We work on the children and informing their nervous system with our nervous system in something we call co-regulation, because it's very powerful to human touch. And when I discovered N.O.T. and looking at that, it is also body work and also very intuitive. I felt that it's kind of like such a great way it's so easy to integrate it with this kind of body work. But what I found fascinating was that it seems to be N.O.T. seems to be like the groundwork for everything else. It seems like we need to do N.O.T. before any other body work, before doing primitive reflexes work, or before doing ABM or Feldenkrais, because then you would be taking care of maybe, I don't know what, 60% of whatever deficiencies the child has with N.O.T., where if you went straight to Feldenkrais or ABM, it would be a longer process, like a year or two before we even get to that place where there are significant shifts. And I remember Dr. Samrat, Dr. Seva
Reza Samva.
Reza, thank you. Yes, brilliant doctor. He said
Yes.
You need to do N.O.T before primitive reflexes, because
Yeah.
without it, the primitive reflexes would not even click in, which are, needed for the baby's survival, the baby's development. And so
Yes.
it's like groundwork.
It is. It is. It's the basis of pretty much everything. Before the digestive process, before the hormonal balance, before the, bringing the fight flight down is the primary tool to then build the other survival reflex systems, calm those systems down, organize those systems. So if the child is in fight flight or has been born in fight flight through a very stressful pregnancy or a very stressful birth, then working with the TMJ, because the TMJ is, or the jaw is so huge in all the processes in the N.O.T protocols. And it comes in various different ways. So with the N.O.T, you're really looking at the signal. We're looking to see what is the signal of the body telling us. So we use manual muscle testing. We use what's known as applied kinesiology, manual muscle testing, which has been evidence-based by Dr. Ann Jensen, PhD, from Oxford University. And it took 10 years for her to evidence-based manual muscle testing. And online, if you Google applied kinesiology or manual muscle testing, it says it's not evidence-based, but it is evidence-based. And also now we have Dr. Heidi Havoc, who's another PhD in New Zealand. And she's doing further research to, again, show in a different way that manual muscle testing actually does work. So we're talking to the human body through the nervous system, asking questions, touching points in the body, and muscle testing. A strong muscle, if you touch an area, then goes weak. So the gluteus medius, which holds the hip to the pelvis, is the same kind of muscle that holds the jaw to the cranium. So these two are communicating with each other all the time. And then this is the gait reflex system that we're talking about. In fight, flight, or dural defense, which comes in very early in the technique after the basic 1 to 8 centering, we then are asking that primary question after cranial injury. Then we ask fight, flight, is that there? Is that active? And if a strong muscle goes weak, we know that the person is in that dural tension state. And the dura is like so strong. A ligament is strong, but the dura is even stronger. And it holds the brain in the cranium, and it locks in at cervical 3 as the first attachment. And then the next attachment is down at lumbar 3. And then the sacrum. And like a dog, when a dog is scared, it will tuck its tail under. So we get into that position of dural defense where the head comes forward to protect the brain and the heart rate goes up, the stomach function goes down, and we get ready to run or fight. And humans tend to get stuck in that process. We can freeze and fawn as well, but that primary survival reflex of fight flight, if it's not deregulated, can then cause numerous problems, and then it can flow over into affecting digestive system, immune system, and endocrine systems. So that is so important to enable the child to deregulate that fight flight reflex.
Right. And the candidates for this neural organizational technique would be children who have had some sort of difficulty while birthing or difficulty within pregnancy. Would you say, Dr. Julie, that only if they've had some sort of traumatic experience in utero and also the birthing process and maybe early childhood? Or would you say that every child should go through N.O.T?
I think every living human being ought to be checked
I agree.
for whether their system is held in that pattern. Because
Right.
if it is held in that pattern, then it will also shut down stomach function and create then some digestive issues
Right.
that are so much more readily corrected if the nervous system is organized. So the lineup is fight, flight, immune, digestive, and endocrine. And when you think about it, the speed of the nervous system works that way as well. So fight flight will kick in a split second.
Right.
And this is where the breathing techniques are so important. And for us to be conscious of those and catching ourselves at that point before we put our foot on the petrol and zoom ahead. To be able to be conscious of that moment and step back and breathe and then check in with your body and then see where is that affecting me, and then preferably let it go, because nobody wins in an argument, really. It's much better to be in a state of, as I said, deregulated parasympathetic nervous system. All children would benefit from this because any kind of invasion, even yelling or a trauma, and birth is traumatic for all of us. And then there's another paradigm with cesarean sections. But if a child is born very stressed in fight flight, then I would say, yes, they're very much a candidate for that. And these reflex systems grow out of the primitive reflex systems. Right. So the primitive reflex systems become these survival reflex systems of fight, flight, immune system, digestive system, and endocrine system, hormonal system, which they are systems. And of course, the brain is like the hardwire, and this is the software. So the brain is controlling everything.
Yes, yes. And that's what I love about this work, because if you're following Germanische Heilkunde or Germanic healing knowledge, we look at the psyche brain organ relay. So that's like the transmission of this signal comes from the psyche, which vets the environment for danger or safety. And if it's in danger, then it will go from the brain to the organ, which needs to step up for survival. But it feels like that relay goes through the vagus nerve, which connects everything, the wandering nerves, CN10, which connects everything with two branches, and then sends signals afferently from the senses. 80% of the signals are afferent, which is from the organs to the brain. It's kind of like an FBI agent looking and then reporting to your headquarters. We're in danger, something like that.
Exactly. And in N.O.T, the energy flow comes in through the right brain to the left brain, down to the physical body. And then what you're talking about with the vagus response is primarily the amygdala pituitary axis, which turns on the adrenaline, and then the fight flight reflex kicks in through the vagus nerve, and everything goes into hyperactivity. So we want our nervous systems to be calm and in a state of deregulation. So that does line up very much so. So with what Carl Ferreri discovered is that we arm ourselves for battle through the jaw. So when it comes through, when the emotional input comes through the physical body, or through, it will filter into the right jaw, then through to the left jaw, and then we come forward, the head comes forward, and the physical posture goes into that jural defense. So in taking out the jural defense, in releasing the jura, you're turning off the whole neurological pattern, which is within the fight-flight reflex system.
It makes so much sense. And is there also something about the Achilles, that area also, that kind of keeps information also about fight or flight, because it's kind of the activation or the movement before that activates fleeing or fighting?
Exactly, because in the morning when you wake up and your feet hit the ground, the sensors on your feet or the adrenal points then talk to the back, the quadratus lumborum, the gastrocnemius muscles, which then filter back up to lumbar 5, which then filter back up to the adrenal system, to the brain, to the pituitary, back down to the adrenals, and the body says, okay, this person's now going to move. So the feet and the Achilles tendon link. The Achilles has the major nerve supply from lumbar 5, which then has what's called love it brother, or the opposite end of the spine to cervical 1. So L5 relates to C1, the coccyx relates to the sphenoid. So there is a correlation between what's above and what's below. So yes, but there is also an internal lock. So there's an external lock on the cranium, which is what I was talking about, where we go into that protective mode. But there's also an internal lock, which then affects the neurology from the maxilla to the diaphragm to the pelvic floor. And this is very, very important with women that have had cesarean sections or any kind of abdominal surgery or ptosis, urinary incontinence, children with enuresis or bedwetting. So the neurology is very important. The tracts, the long tracts that cross over and the tracks that go straight down as well. So
Right.
yeah, so it's
Amazing.
all integrated. The body is a complete holistic. We're not car parts.
Oh my gosh. This is so groundbreaking. It's like, how did Dr. Ferrari discover this? I mean, was it a download or something like that?
He was, Dr. Carl Ferrari did 18 years of research before he came out with this technique in 1979. And I met him in 1984. So he already had 18 years plus the extra 5 years behind him. He was a student of George Goodhart, who was the founder of applied kinesiology. He also knew another very profound chiropractor within our profession named Major Desjardins, who developed sacro-occipital technique. And Carl Ferrari also was trained in Chinese medicine. What he did was he gave us a roadmap, basically. He put a sacro-occipital technique, which is a centering balancing technique from cranium to sacrum, to release the dura in the various categories that you can find. Category 1 would be the shearing of the sacroiliac joints, which then creates central disturbance. A category 2 is a shearing of the sacroiliac joints and then a separation, which is like a sprained ankle in your low back. And then that would create a psoas contraction. And then the patient or the client presents in an antalgic position. A category 3 is where you don't want to go really, because you've got shearing, separation, and a rotation of the pelvis. And that's when the discs become involved and you start exhibiting symptoms like sciatica. So that is SOT. So he uses blocks and a blocking technique to balance the pelvis to the cranium. And to some of the category 1 and 3, you have to block face down, whereas category 2, which is a weight-bearing category, you have to lay on your back for that. And laying on your back does the adjustment through the breath. So there's a lot of breathing with that one as well. And flexing and extending the Achilles tendon while you're lifting the occiput. So it's very holistic. And then with the applied kinesiology, which is the muscle testing and the various organ systems which link to neurovascular and neurolymphatic reflexes, and tells you basically where to go. Carl Ferrari finishes the he'll open, he said to open the protocol, which would be the signal, to find the signal. If the signal is not firing, do the protocol, come back, recheck. And once you come back, recheck it strong, you know that system is now operating at its optimum. The key with N.O.T. is to have all the systems organized and functioning properly. Sorry, that's my doggy there. Yeah. So, but he did say that he felt like God had given him a little window into how the human body worked. And he read an article on centering in sexual reproduction and how humans have to line up to reproduce. Every living organism really has to do the same. Even a rhinoceros has to line up with another rhinoceros to reproduce. So these are the centering, anterior centering reflexes and posterior centering reflexes.
The cloacal, right? Yeah. Okay. Got it.
Yeah,
Oh my gosh. Makes
exactly.
so much sense.
Yeah, it is. It's wide and deep. But what I did realize is that we're all looking to bring that fight flight reflex down. N.O.T. Once the patient has been cleared of cranial injury as well, which is checked basically through seeing if the head is intact with the body. If it's not, all day long you're subconsciously holding your head up, and that's so much energy that you're
Yes.
using to hold your head up because the reflexes have been knocked out through either a motor vehicle accident or domestic violence, or just banging your head as you get into your car can knock things out. So the cranial injury complex, which he termed cranial injury complex, brings in the labyrinthine reflexes, the ocular riding reflexes, and the vestibular riding reflexes, like the cat reflexes. When a cat falls, it has to rebalance and land on its feet. We
Right.
have the same reflexes that keep us in alignment with gravity and the horizon so that we're not walking around feeling nauseous and falling over. So this brings in the vestibular ocular reflex, which is so important with children because if the VOR, the vestibular ocular reflex, when you hear a sound, you'll turn. You hear the noise and your eyes move and your head moves as you hear it and your eyes go. If a child's standing on the side of a curb and a car is coming by and there's a delay, because it's a bit like they're a little bit out of sync, as if somebody's talking, but they don't hear it right away. There's a delay because the vestibular reflex is not intact. So this is where auditory processing comes in. So the
Right.
auditory processing comes in through here. So in releasing these reflexes and centering these reflexes, and then the neck riding reflexes as well, you can bring the head back into position where it's nice and strong. Now, the other thing that Carl Ferrari did that was just amazing was he brought in the IA factor, IRT factor, in relation to. So when you do N.O.T, you check in the day and in the dark,
Right.
eyes open and eyes closed.
Yes.
So if someone comes in and says to me, it was a cold and rainy morning and I was hit from behind, I know already they were hit from behind. Their eyes were probably open. If they were hit from the front, their eyes were probably shut. So you fix it as you find it and you do the protocol in relation to how the injury occurred. And then the brain absorbs that, knows that information, and the neurology is reset at that point.
It's brilliant. Oh my gosh. Eyes
He
open, eyes
was
closed, in the
absolute
dark, eyes
genius.
open.
Yeah.
What?
He ought to have got the Nobel Prize for this work. He really
Yeah.
ought to have, because during COVID with the immune system protocol, those patients, clients that were aware of the immune system protocol in N.O.T, they were lining up for this treatment because the immune system we address from spine to organ, and we address from organ to spine. And it's a lot to do with, well, thoracic 1 to 12 is your immune system. Coming, of course, the limbic brain is where the immune system begins, and then it travels down through the foramen magnum. We open the circuit through thoracic 1, and thoracic 1 to 4 is heart and lungs, and 5 to 6 is stomach and spleen, pancreas, stomach, adrenals, kidneys. And then that thoracic 1 to 12 do fixation, release the fixations, come back and recheck thoracic 1. Then we turn the patient over and we check through spleen 21, which is at the level of the elbow. And you check spleen 21 on the right and spleen 21 on the left. And so if that shows weak, then we know that the immune system is not firing from organ to spine. So organ to spine, which is called visceral somatic. So we do spleen, thymus, liver, and then there's a whole protocol that goes through the Cochin cycle in Chinese medicine through using applied kinesiology. And you can also transfer one program from one side of the brain to the other with EMDR, eye
Yeah.
muscle transfer. You pick the program up from one side, you load it to the other, and you put it back into memory. So yes, it is amazing.
Yeah.
And we get really, really profound results.
Yeah. I want to ask about that too. But my question, Dr. Julia, because there's so many crossovers with NAET. I practice Nambujipad's allergy elimination technique, which is also kind of, it uses acupuncture, it uses a little bit of N.E.T, it uses applied kinesiology, and we also do muscle testing. We ask the body, and there have been really profound effects around that. But my question is, Dr. Julie, are we able to a certain extent, are we able to do self work? Because a little bit of applied kinesiology is, you could also do your muscle testing, your own self, and then you could kind of just really be neutral and see, am I balanced or not? Then do the
Yeah.
work and then balance yourself. Is there a possibility to do N.O.T on yourself? Like even you as a very advanced teacher practitioner.
Yes, yes, there is to a certain degree. For instance, cranial injury complex, which I just spoke about, you can
Right.
do that on yourself. Anterior reflexes, posterior reflexes, you can do those on yourself. Immune system in the anterior position, you can do. Digestive jaw, you can do. Now, Ann Jensen, PhD, when she taught us her findings, she was muscle testing through her forefinger and her second finger. So she
Yes.
was doing it this way. Her control was, am I a male? Am I a female? Am I a male? Am I a female? Or is my name Julie? Is my name Fred? So you can create your own control on that. It takes a bit of practice, but if you're proficient like you are in manual muscle testing, this is the diagnostic tool that we use in N.O.T and in N.E.T and in a lot of the other techniques that are now getting a lot more attention, and research is being done on it. So the answer is yes, not in its totality, no, because it is a very organized technique. And Carl Ferrari was very specific in stating that you need to do the protocols in an organized way because the body functions in an organized way. And that brings me back to the speed of fight flight, how that will kick in very quickly. Then immune will take 6 to 12 hours, where the body will either say, well, it may be immediate if the poison, and the body will say vomit or diarrhea, or there'll be a fever, or an incubation period may be instilled. But the speed of the nervous system is then correlated to those systems. So digestion is then through the night, which is we give, say, 12 hours for digestion through the night. And then the hormonal system, which links to the female cycle of the 28 to 30 days. So the speed of the nervous system is fight, flight, immune, digestive, and endocrine. And he gave that information to me. So I found that very fascinating, very fascinating. And something that once said was, he read an article about the sexual writing reflexes. And in understanding the sexual writing reflexes, it allowed him to then realize what the gate mechanism was about. So when we're talking about the gate mechanism, that's the right, left, how the arms swing. And in a dyslexic pattern, the right arm, right leg will come forward, and there won't be the cross patterning that's needed in a non-dyslexic
Homologous. Okay.
client.
Yeah.
Yeah. So that would be that would be termed a switch. So there would be a neurological switch in a dyslexic child. As
Right.
there's a neurological switch in asthma, where you can't breathe in or breathe out. And there's also a neurological switch in scoliosis. So switching is a known factor in applied kinesiology, but he then applied this to a lot of his protocols.
Right. Amazing. Would you
Yeah.
then, Dr. Julie, I'm actually cesarean born, so I know that I lack some mechanisms because I know the actual birthing reflex. I know there are primitive reflexes like the ATNR that's required for the twisting into the vaginal canal. I missed that because I was born cesarean. And would you say that how early can a cesarean born baby receive N.O.T after being born?
Okay. Well, my first son, we treated him on day 5. And my second son, I treated him as soon as he was born. So with neither of them was cesarean section, but my second child was born quite stressed. And I knew that there was an area that needed to be addressed. So I went straight to that area and corrected that area as quickly as I could. With cesarean section babies, we rub down. We go down the front of the body and ground, have that grounding energy down the nose, the lips, and straight down. And mothers can do this with their babies. When they're bathing them, they can ask their husbands to do it as well, to just rub them down. And then that gives them the grounding that they didn't get through coming through that neurological pull that through the vagina. A lot of cesarean section babies sometimes don't really know where they are in time and space, and that's because of that. But it can be very easily corrected.
Right. Can it be corrected even if you're a 53-year-old? And
I don't see why not.
Because
I don't see why not.
yeah, because Dr. Julie actually gave me a session not long ago, maybe a month and a half ago, when Dr. Julie was here, because Dr. Julie has connections in the Philippines, right? She has family here, and
Yes.
she happened to come, and she did a demonstration and a session as well to address. One is my being cesarean born. The other was that I have actually a cranial injury from falling straight on the back of my head, right on the occipital lobe. So I had a subdural hematoma. And I remember that you helped me with that. You addressed that as well. And I would say that after your session, I was able to somehow realign the jaw. For some reason, I'm able to now chew on my left side. But I've had a few osteopathy, maybe a couple treatment to push the pterygoid muscle, because it more comes on the right, and the pterygoid was being pushed and to just mechanically realign it. But for some reason, it would kind of go back very slightly. But after your session, I would say it's righted itself more
That's
naturally, that I could actually chew on both sides now.
Yes, yes. So the internal pterygoids, coming to that, that's very interesting point, because the internal pterygoids, so those muscles inside the mouth where the dentist will put the needle in right up in, those muscles strap the jaw, the lower jaw, to the actual rami of the jaw here on the inside. And there's a medial pterygoid and there's a lateral pterygoid. So there's muscles that run this way and muscles that run this way. And they are kind of for like where they are chewing mechanism, like chewing the cud, so to speak. But the jaw functions mouth open, mouth, yeah. And the buccinator muscles, when they are not functioning correctly, the mouth can't bring the food in as readily. And this can be a problem for breastfeeding mothers as well. So we start with releasing the buccinators, then we work the masseter and the temporalis muscles, and then we work the internal pterygoids. So there's a whole group of muscles in and around the digestive jaw system. And then once that's reset, because also if a baby is born posterior presentation, then you're going to get more of a retro jaw. And that is then going to be driven by these internal pterygoid muscles. So if they're really tight, they need to be released from inside, but not to adjust the jaw, but to get to the neuromuscular system in this way. So that's the nerve to the muscle, and then have the nerve to the muscle functioning correctly, and then the joint will do what it's meant to do. And the same principle applies to every joint in the body. If the nerve flows to the muscle contracts correctly, the joint will then contract, the biceps will contract and the triceps will release. So there's the antagonistic muscles as they do that. But if the pathway of the neurology is not getting through, if there's interference through either subluxation or cranial injury, or reflex is not firing correctly, then you're going to get aberrant joint movement, basically. So we're always looking to center, realign, and get all those systems working to their optimum. And then the human body functions to its optimum, because it's like almost like computer programs in a way.
Yes, I was actually going to say it feels like a computer program that kind of writes itself or reorganize. That's why it's called neural organizational technique, because it self-organizes with the proper tools and input or signal. It
That's
just
right.
writes itself.
And correct. And the more treatment you get, the more neuroplasticity kicks in, the more your consciousness will open as well. And Reza Samvat has written a whole book about that. And I've seen that in patients as well, that they will go from being in one state of mind to being in a completely different state of mind and having a much healthier, happier lifestyle. Now, what I would like to also mention is with the digestive jaw, once you reset that, you then ask another question. So digestive jaw would open with mouth open wide, because when we open our mouth, the body believes we're going to feed. And like a birdie sucking bringing the food in through the buccinator and the masseter and the temporalis, as that jaw opens, once you've reset that, then you come and you ask about the valves. So we've got 4 valves in our digestive system. In our pyloric valve, they come in pairs. You would have heard of the ileocecal valve, the Eustonian valve, the one between the sigmoid and the colon. And then on the other side, the ICV, where a lot of people will exhibit pain and problems prior to appendicitis. So that valve, which is actually another sphincter. So we've got 4 other sphincters or 4 other bottoms in our stomach. So that's the pyloric, the cardioesophageal, the valves of Houston, and the ileocecal valve. Now, those valves have to be opening and closing, and they're muscular valves. So again, the same principle, a different kind of muscle, but the neurology to those valves needs to be firing correctly for the patient not to be constipated or not to have alternating constipation and diarrhea, etc. And all the Crohn's and gluten intolerance and all those inflammatory problems can be sorted once you've reset that digestive system. And I really work a lot with the blood type diet, because the blood type diet will tell us what we can eat and what we can't eat to keep the lymphatic system down, so that we keep the inflammation down, and so that we're not eating a food that the body can't digest, basically. So a blood type O will crave protein, but it's not good with dairy or wheat. A hunter-gatherer is blood type O. They were out there hunting and gathering, whereas blood type A, they were sitting around with the chickens and growing the grains. And so they're better with chicken and the ancient grains. But all of us are lactose intolerant except for blood type B, apparently. So dairy is basically for cows.
That's what I heard too. I'm actually, yes, I learned about the blood type diet. Is it Peter Damo or so? I forget the name of
Yes,
the
that's correct.
Damo
It's
or
the Dharma brothers.
something
The
like that.
Dharma brothers.
And
They
this
were
came out in the night.
naturopaths. They did 40 years of research on the blood type.
Yeah.
And yeah, my youngest son had asthma, and we couldn't. My husband's a homeopath, and we were working with homeopathics and with the chiropractic technique. And it wasn't until I actually went to a naturopath and she said, let's try the blood type diet with him. And so I applied blood type A, and he was having asthma attacks every 6 weeks cyclically. And once I removed the spaghetti bolognese that he was having 2 or 3 times a week, because we love our allergies, we tend to crave. So I didn't realize I was giving him wheat, tomato paste, and red meat, which were all 3 things that were triggering his own reaction towards himself. And
Yeah.
after that, it was quite remarkable. His asthma settled right down. And at 7, he grew out of it. A lot of children do grow out of asthma at 7, but it was really obvious how much better he was. So
Wow.
that proved it to me, and I've proved it on myself as well. If I have too much white bread or any of that, then I do tend to suffer at about 5 in the morning.
That's interesting because when we look at NAET, Nambudrapad's allergy elimination technique, so there's no really such thing as an allergy. They're only like anchors for a past distressful event that anchored sensorily on whatever substance was around you, food. So we can also have subconscious distress around a person. So we
Yes.
would call it a person allergy and all. And it kind of feels like a little bit like NOT, in which it realigns everything, or rather removes the person from fight or flight vis-a-vis that particular food allergen, for example, so that, when that realignment happens and that person is exposed to the same food allergen, there's no longer any effect, and they can just consume it. Were you able to
Yes.
also try that technique with your
Yes.
son yourself?
Well, that's where I would bring in NLP, and then the NET component and NLP would be addressed as well. So Dr. Carl would travel with an NLP practitioner as well. Totally agree with what you're saying, because I had a very traumatic incident around cats, and I ended up with a very severe cat allergy. And it wasn't until I had lactoferrin, homeopathic lactoferrin, and I addressed that psychological stress, that the D component. So, I mean, a lot of what we're talking about is the 3D component, the physical component, or in homeopathic, it would be 6C as opposed to, say, C, going up into the mentals more. So with N.O.T, we plug in the mother, father, sister, brother, or any emotional component through that right TMJ, which triggers the fight flight reflex, and then through the spleen 21 for the immune system. Once the immune system is strong and stable on the 3D, then we come in and we'll ask the allergens. So we do the applied kinesiology, checking dairy, sugar, or any of the actual physical components. So, and then with the NLP, you can pick up the psychological problem and go back to birth, or even into utero with that. So Carl Ferrari would say, put wet on the
ESR?
head. Yeah, put the wet here, and then do the treatment, which then takes the first sensation that the baby would have had when the baby was born, which would have been feeling wet. So you're then tracking back through the nervous system that way. He was way ahead of his time. He really
Really?
was.
What did
He
he
was.
pass away from, Dr. Julie? Was it an accident or something? I mean, Dr.
What was
Ferrari.
that, Ellie?
Oh,
Sorry, I didn't.
what did he pass away from? You would think that if he had knew the
Oh,
secret
right.
of human biology and the
Yeah,
nervous system.
unfortunately, he was a heavy smoker. When I first met him back in the 1984 in London, it was a day that really changed me and my colleague's life. We went into the hotel, and at that time, people could actually smoke in hotels and restaurants, and it was all very kind of misty and a little bit smoky. And he was treating a trisomy child. Yeah, so he did smoke, and he ended up passing away from what would have been called circulatory endocrine, where you tend to drown in your own fluids because the lungs break down and the hormone system can't drain those fluids down. But he did work very hard and long until he was well into his 60s, and he traveled. He went into Korea just with his hands. He went to Israel. Loved Brisbane here in Australia. He was all over America, England, Paris. So he really did work to share his knowledge. Yeah. So yeah, unfortunately, the smoking is what took him out eventually. And he had quite a few wives. It was probably best not say too much more, but he was such an intelligent man. He had many children, and he still has a wonderful family in Florida, which I speak to from time to time.
That's lovely.
Yeah,
Okay. I could talk to you for hours, Dr. Julie. Would you share with us what conditions you've seen in children, special needs, and also adults that have had tremendous effects doing NOT?
right. I think the area that is becoming very profound to me lately is scoliosis. Is if you have a child that's, say, 8 years old and she's broken her arm, and that trauma has created a distortion pattern in her spine where she's getting one side is a little bit higher than the other. The muscles of the one side are tighter and the others are weaker. And then lower down they're weaker and the other side is tighter. The scoliosis protocol that he developed was taking that switch out with the neuromuscular switch. So if you can recenter the muscle systems, the spine actually gets caught in the middle. The scoliosis isn't the spine isn't the problem in this case. In this case, because there's two nerve pathways to this part of the back through here from the cochlear in the ear. If one of the pathways is there, you'll get a mild scoliosis that will lock in when there's a trauma. If, like in the Hunchback of Notre Dame type scoliosis, the full scoliosis, the two nerve paths are engaged. And this protocol can then stop the process from getting worse. In the first type of acquired scoliosis, as in the young girl who acquired the scoliosis through the trauma, you can do the protocol and take that switch out. And I have quite a few children that I'm treating for this condition. And at 8 years old, it makes the world of difference because then they come into puberty. They don't then have all those problems with the weak reflex systems around their pelvis or around their shoulder girdles. And you've actually literally taken the tension out of the spine, pulling one way from that neural pathway and then pulling the other way lower down. Because the nervous system is so clever, it won't just stay like that. It will compensate back because the ocular riding reflexes always want to be level. And that level is so we can look around, see our danger, and find our food, basically. To get
Right.
out of the way and then to survive. So scoliosis, I think, is one of the most profound. Learning difficulties, again, with dyslexia and learning difficulties. He became quite famous through the treatment of realigning the sphenoid. So if the sphenoid is tilted down on the left, and if you look at your clients, you can see that tilt. It can either be down on the left, which is a dyslexic pattern, because of the writing reading area, Wernicke's area on the left. If it's a right descent, it's an emotional immaturity or an emotional problem that's exhibiting itself. So in correcting the sphenoid, it's like you're balancing right and left brain, corpus callosum, and then the tentorium, falx tentorium. So the cranial work is the icing on the cake, because once you've done the basic Module 1, you've done the visceral components of fight, flight, immune, digestive, and endocrine. And you've cleared out another protocol called cardiac back. So we can also treat or notice the first signs of impending heart problems through cardiac back. And then also, once you've cleared that, you then go into the cranial components. And there were 7 cranial faults that he recognized would indicate a learning difficulty or dysphagia or dyspraxia or dyslexia. So, yeah, the cranial work is very, very important for the children.
Did you see a
And
lot of benefit? I mean, like kids starting to be able to speak or overcome dyslexia from how many years of work or how many sessions?
yes, there is an ADHD protocol as well, which takes 18 months. And then there's all of this is quite holistic and generalized. So we don't necessarily make a definite diagnosis. We just find what's not working and we aim to get it to be functioning properly. So to allow the body to do what it's meant to do. That's my dog screaming. But yes, the children benefit tremendously because the cranium at that point, and the cranial bones move. A lot of professionals don't think the cranial bones move. But, there is an article here on Do the Cranial Bones Move? And it says, if you don't think the cranial bones move, ask the Italians. Because the cranial bones are like sutures. They're
Right.
sutures. They're not like jigsaw puzzle bits like the vertebra.
Correct.
They suture together. And when you have a cranial injury, those sutures will jam. So our job is to gently, gently release the sutures and get the motion of the cranium to be working, because the cranium works like a pump. As we breathe in and out, the sphenoid is swinging up and down, it's swinging. And that pulls the blood in the cerebral spinal fluid up to nourish the brain. So cranial work is where we're aiming for in module 4 to complete the protocol,
Right.
complete the protocols. Yeah.
Would you say also, Dr. Julie, that there's also a possible a lot of trauma that happens in the dental chair itself because we're doing jaw work and it's open and it's scary and would you have you seen somehow a lot of trauma from the actual dental chair itself?
Yes, definitely. In my own experience, I'll often ask the dentist to stop and I'll reset my internal pterygoid muscle. He knows what I'm doing. But the bruxing that goes on, it's really the body trying to drain the lymphatics down. It's not that you're grinding your teeth. It is a stressful process, but the nervous system is bruxing to drain the lymphatic system down because of the congestion in the inflammation through the jaws being very tight and tense. But the dentists, yes, yes. There are some very alternative dentists out there that do muscle testing as well. And some really enlightened dentists are working with applied kinesiology as well. So to answer your question there, yes, because there's the fear component that comes in. And there's a fear component with people seeing chiropractors as well. But the more low force chiropractic techniques that we're talking about, there really is so much evidence behind it now that it is perfectly safe. I will rarely do a manual adjustment unless I'm asked or if I feel that it really is needed. So I will work more with the N.O.T, which is kinesiology based.
Wow. And could you see just by seeing somebody standing in front of you or walking, would you already be able to see what this person needs in terms of N.O.T? Like, what kind of deficiencies or impediments they have?
Yes, to a certain degree, yes, Ellie, I think so. Especially with the scoliosis, you can see a high shoulder on one side or another. You can see a forward posture, which would indicate that there'd been a cranial injury and that had never been corrected. So you see some old people walking around like this, and they don't have ankylosing spondylitis, but they have not got the strength to hold their heads up. And so their forward posture shows. This also shows in cardiac back and category 3. The antalgic posture would be a category 2. So with children, you can also see there would be an adductor weakness if their knees are inverted. And if there's eversion of the feet, it's a psoas weakness. So there is quite a lot that can be seen. Not everything, but there are other telltale signs, like, of course, if there's candida on the tongue or if there's cold sores, then you think about immune system, things like that, or digestive. And a lot goes on in the consultation as well. But really, once the client is in and on the bench, it's just the body feeding back the information as to what needs to be corrected through the techniques.
Which is what I love about it. It's still your body that's healing itself because it's built to do that, to right itself.
Exactly.
Yeah.
Yes, yes. And the neuroplasticity, because the brain is plastic, the brain is like, I will repair, it can repair. Even from
Absolutely.
major traumas, it can repair. And music is so important too. Music and, our senses, our smells, of course, physical touch and community, family and community.
Co-regulation. Right.
Yes. And
Oh,
prayer and
yes.
meditation. Yeah.
Absolutely.
Yeah.
Yes. Beautiful. We
And
just had
then,
mindfulness meditation yesterday and it was
yeah,
beautiful.
beautiful. And then you were talking also about between 3 and 5 a.m. and the organ system that comes in through 3 and 5 a.m. is the lungs.
It's the
So
lungs. Start of
lungs,
the day. Yeah.
yeah, which
Yeah.
link to grief and, healing through the breath. So the lungs are very important in the
Right.
healing process.
Amazing. Dr. Julie, I also wanted to check. It's my dream to bring you over here and to possibly have N.O.T, be taught to most people. Is there do they need to have some sort of bodywork training? Do they need to be chiropractors? What? Do they need any of that in order to learn NOT from you, or can they just be a mother of a special needs child who wants to do some work on her son by herself without seeing a practitioner?
Okay. I understand your question. They're within N.O.T. Global, which is Simon Carlin, Reza Samba, and there's a whole team of us here in Australia. And then there's N.O.T. International in America as well. So the base standard is 3 years of health sciences to do or to be a fourth or fifth year student of a healing modality. So we do need that basic health science behind these students. If a mother wants to learn the lay balancing mechanisms, there is Touch for Health, which
Right.
is, Touch
I'm
for Health.
enrolled. John, I forget his last name.
John
Yes,
Tai, Dr.
John Tai.
John
Yes.
Tai in California. He took applied kinesiology to the lay person. Also, Dr. Ann Jensen, she's also a psychologist and she does something called Heart Speak. So Heart Speak is something else that could be looked at to help with emotional regulation. But for the physical work, I would say if they want to do work with their children at home, to definitely look at the Touch for Health programs.
I love his program. He has something called the Meridian Dance. And we go through all of the meridians, starting from the stomach meridian all the way down. And it's a dance that you could just balance it on your own and just, each meridian.
Yes.
It's so
It's
beautiful.
very, very intuitive, isn't it? And you just kind of feel it and just go through those meridians. And in a way, I know this kind of dates me, but if you think of Michael Jackson, you watch Michael Jackson dancing, he was dancing through his meridians, literally. But
I love
yeah,
it. Very
and
centered, wasn't he?
yes, and then there's the ecstatic dancing, just the
Yes.
free dancing of just going with whatever you feel. And again, I believe that is through the meridians as well. So they're very powerful in N.O.T. Closing down the circuits. Yeah.
So amazing. Okay. And that I'm very happy to be enrolled in the program with Dr. Carlin, with yourself, as well as how I
Yeah.
met you actually for the past year and a half. And
Yeah.
I've learned so much, but I would really love more mentorship and find a way to bring it here to the Philippines to qualified practitioners.
Well, I need to speak to Dr. Carlin about that. There is a master class where they cover module 1 to 4 in Perth in November. And
Okay.
if we can't get to you, it's a 6 or 7 hour flight, Manila to Perth. And Philippine Airlines does fly direct. And if you're going, I will be there.
Okay.
I'll
Okay.
do my best. If I have to come back to Manila, if I do come back to Manila to see my family there, then I would definitely let you know when I'm coming. And we will do something not just in the bedroom in the Savoy Hotel.
Right. Yes. Yes. Something more formal. Yeah. More
Yeah,
educative. Okay.
yeah.
Okay. Wonderful. Dr. Julie, thank you so much for sharing your wisdom. It's really been such a gift to know that you're carrying the legacy of Dr. Ferrari into the world and then teaching us as well so that we can carry it forward. So thank you so much for sharing that. And how may people reach you? Do you do any work online, consultations? Or how is that delivered?
Okay. My website is drjulieclarkcairo.au, and I can be reached through that website. And if anybody wants to speak to me directly, they can contact you, Ellie, and get my mobile number here. I'm happy to talk and share this information to anybody that's interested. It's good. It's so good that you're learning it. It's so good to have someone so interested in it in the Philippines. It's wonderful. So we do need to upskill you, Ellie, so that you can teach others yourself.
It's true. Yeah, I would really love to, Dr. Julie. And what I'll do is I'll make this a podcast episode and then we'll upload your information to over up to the show notes so people can reach you more and people can learn about this technique. Yeah. Thank you so much, Dr. Julie. And
Thank you for having me, Ellie. It was wonderful to see you again.
yeah, likewise. And my pleasure. And I think I think Clyde would like me to make an announcement. Clyde, is that yes? And that we are launching the Unlimited Biohacking Academy, where we would like to offer courses and very basic, intermediate, and advanced biohacking courses. So basically, it's about the self health movement. So as you heard our conversation with Dr. Julie today, the body heals and organizes and balances itself. It's this. There's a mechanism that's already built in to self correct, and we just need the belief, the right belief, the mindset, and the tools and teachers like Dr. Julie to assist us in further educating about this. And the hub that I would like to create is this biohacking academy, where we can teach anybody who's interested in self health and learning about their superpowers come over to the biohacking academy. So thank you so much, everybody, for watching. Thank you, Dr. Julie.
Thank you, Ellie.
And we hope to see you here in the Philippines.
Okay, thank you, love.
Bye, everybody.